Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, I'm Judy Richards, and I would like to welcome Deb Patterson, Democrat candidate running for State Senate District 10 as the incumbent. Welcome, Deb.
Thank you so much, Judy. It's nice to be here.
Tell us about the votes and legislation you supported last session that directly benefited our seniors and people with disabilities.
Well, thank you, and thanks for the opportunity. I'd like to speak, if I may, to the last, to the 2021 session and 2022, since that was the last time I've had an opportunity to talk with the listeners who are affiliated with Northwest Senior Disability Services. In 2021, I was chief sponsor of a bill that was Senate Bill 844, which puts in place a pharmaceutical drug affordability review board. We know that the cost of prescription drugs is about 11% of our healthcare costs these days. And for seniors who are on average on 4 to 5 prescriptions each, some of which are for rheumatoid arthritis, very expensive medications, or cancer, again, often very expensive, especially immunotherapy. It was really critical that we take a look at this. And in addition, many people take multiple insulin products as well, which have been extremely expensive. So I was pleased that despite the fact that Big Pharma spent $2 million to try to defeat this bill, we were able to create this board. It consists of an executive director who is staff to support this work, as well as 8 medical providers or economists without ties to the drug industry who are working to evaluate strategies for making pharmaceuticals for Oregonians, including and especially our older Oregonians, more affordable. I'm pleased to say that they began their work in June of this year. We do have 6 of the 8 board members in place, and we had an initial report from them at the Senate Healthcare legislative days in June, and we'll be continuing to follow that closely. I'm chairing the Senate Healthcare Committee, which is a wonderful opportunity to be able to advocate for seniors and people with disabilities around health-related concerns. We also had a report at one of our informational hearings about the drug transparency program the Oregon Health Authority is operating. And so those are working hand in hand together. I'm very excited to hear what strategies they'll be recommending for future legislation to make pharmaceuticals more affordable for every Oregonian. In that session as well, we know that the pandemic hit folks living in long-term care very hard, particularly before there were any vaccines. And so one of the bills for which I was the chief sponsor was Senate Bill 714, which puts in place staffing ratios for long-term care facilities, which was really critical given the fact that staffing was difficult to find. But people who are in a nursing home care, long-term care, absolutely need to have the staff available to help them to bathe, get to the restroom, and others. My own mother and mother-in-law are both in long-term care facilities, and I've seen very close and personally the care that is required for the residents there. And as being clergy for 30 years and visiting folks in long-term care, I know how critical it is. I was really pleased to be honored by the Long-Term Care Ombudsman Program as their Legislator of the Year this last year. I will continue to advocate for affordable housing and for the needed services, whether it be independent living, assisted living, or long-term care. So that bill I was really pleased to see that pass. In this 2022 session, I was chief sponsor for Senate Bill 1556, which puts in place a public-facing certification registry for long-term care workers. What this means is long-term care workers do have required trainings, but those files are kept at the facility and they're not public-facing. What this would enable consumers who are either in long-term care facilities or receiving services in their homes would enable them to look up in these registries what trainings the staff who are serving them have had, if their background check is current. And so it gives a measure of transparency for consumers, both in facilities and in their homes. In addition, it provides kind of a career pathway for an entry into the healthcare profession through long-term care work by allowing staff to carry this registration, this certification of their trainings from agency to agency or from long-term care facility to another place, and then would be able to present that as if they were applying to go on to be an LPN or for nursing school, they would have this certification registry, which would give them that documentation. So I think that's an important step forward as well. Let's see. Obviously, there were a number of other things that I worked on, but I'm cognizant of our time. So I think I'd better move ahead and I can circle back if necessary. So maybe we could move to the next question, if that would be okay, Judy.
That would be fine. What have you done to advocate for Oregon Project independence?
Well, as I mentioned, I've been clergy for 30 years, and I also headed up the International Parish Nurse Resource Center for a decade and worked with other faith community nurse programs and other healthcare agencies over the years. And so I've been very familiar with the needs of people with disabilities and seniors living in their homes to remain independent and to have person-centered choice. And so when we moved to Oregon, I was thrilled to see that Oregon Project Independence was here and have seen how it really has been able to help many seniors. And so I will and have, as a member of the Oregon Commission on Disability, Oregon Disability Commission, and liaison to the Oregon Commission on Seniors, Obviously this topic came up often, and I will do all I can to fight for the funding that we need and to expand it. It's not enough. We need so much more. There are so many more people in need of this. And I really do not want to see our seniors have to spend down their assets to have, the care that they need in their senior years. One of the things that I would like to do, I realize it's unrelated to Oregon Project Independence, but I've been in conversation with Senator Wyden and others to try to see if there's not a way that we couldn't do something similar to the Oregon ABLE plan, where we could allow people to prepare for their senior years and the possibility that they'll need assisted living or long-term care or home care by protecting a portion of their assets, perhaps up to $100,000 in a special fund that their family would be able to then use to provide additional services to them as they age, rather than having to spend down to destitution to be able to qualify for the services of Oregon Project Independence and for Medicaid in nursing care.
Thank you. The next question you've somewhat summed up already, but I'm going to read the question anyway, is how would you prioritize the funding for services to an ever expanding senior and people with disabilities population?
One of the things that I've been in conversation with some of our small business owners who are insurers here in the area is the possibility of considering something like they do in Washington State, which is to have a state-based long-term care insurance program. Clearly, the market doesn't work for private insurers to cover long-term care insurance. Most providers have gotten out of this, providing that coverage or offering that coverage. But in Washington, where it is an opportunity where all of the residents are involved in that, it does increase the size of the risk pool, and so it does make it more viable to have this coverage. Again, returning back to why should I kind of call it, why should the middle class have their assets hoovered out as they spend down? The very wealthy can afford private pay, as we know, and that's a wonderful thing, and I don't begrudge them that one bit. But I am sorry that it is such a financial burden on so many of our older adults, and I don't want the cost for long-term care to be borne by the workers who are staffing the homes. They need a living and fair wage too. Our cost of housing is so high, as you know.
Thank you. Thank you. What would you do on a state level so that the services for seniors and people with disabilities have increased access to affordable housing and appropriate nutrition?
Well, one of the bills that I had in the short session, as you know, we're only each person only gets 2 personal bills. One of my 2 personal bills was Senate Bill 91, which would have provided additional funding for people who are for seniors and people with disabilities who are currently living in affordable housing. But the long-term lease that the owner has with the state to provide affordable housing is about to expire. We wanted to do this on a statewide level to provide additional supplemental funding so that if it would move to market rate, the residents in those in that housing could stay there at the same level. They don't have, on fixed incomes, they have no way to pay more when rent rises to market rate. Sadly, that did not pass, even though we had changed it to a pilot project with facilities in Salem and in Washington County being the 2 major facilities in that pilot. However, I just was not willing to let that drop, and I didn't want to see hundreds and hundreds of people be at risk of becoming homeless, essentially. And so we worked with the governor's office and with the Department of Housing and Community Services to see if there wasn't some funding somewhere. And I'm really pleased to say that we did find funding. So those 2 facilities will not, the residents in those 2 facilities, again, it's hundreds of people, I believe it's 200 in Salem and 300 in Washington County, that will be able to remain in their homes through this funding that is provided. So we just, I really like to see more support for affordable housing all around. And I know we only have time for one more question. Sorry.
Thank you.
I just looked at the clock.
What would you, as a legislature, what do you think you would address in the behavioral health issues that have been exacerbated by isolation related to the pandemic?
Well, I was really pleased to vote for the funding for behavioral health. It was $470 million in 2021. That will be very helpful, as well as the additional funding through Measure 110 for treatment of substance abuse, because we know a lot of older adults and people with disabilities also do struggle with substance abuse as well, particularly exacerbated, as you said, by the pandemic, that isolation. I was really pleased to be a sponsor of House Bill 2508, which puts telehealth at parity, which makes mental health services so much more available to people if they don't have to travel, particularly if mobility is an issue. And so that also requires providers to make the equipment available to people so that they can access telehealth if they don't have the ability to do so without getting that equipment. Also, I'm thrilled that at the national level, we now have 988, which is the suicide prevention hotline, which is a national number that went live earlier this month. And I would like to support as much as possible the community efforts being done by the area agencies on aging, all the senior centers. We have a wonderful resource in South Salem through Center 50 Plus, which is available to all in the area. The South Salem seniors have also North Salem Center 50 Plus, sorry about that. South Salem has a wonderful facility that's struggling. We need to support them more. And Kaiser has as well. I would love to see more growth of senior centers such as in Woodburn, which is not in this district, but they sorely need one. And we have to support our area agencies on aging. They do so much and people don't even realize what all they do.
Thank you. Thank you. Well, today we've been visiting with Deb Patterson, Democrat candidate for District 10. Thank you for joining us today for this interview with Deb Patterson, candidate for District 10 and the incumbent. And it's been a pleasure visiting with you today. Thank you.
Thank you. Thank you so much, Judy. And thank you to Northwest Senior and Disability Services for this opportunity.
Our pleasure.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. The advisory councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.